Good afternoon. It is an honor to on the sixth Sri Lankan our colleagues in the Asian region. I am a Dr. Individual and also my co-host is Dr. Samar. In this section of Sri Lankan eHealth Hour, I share our experiences in policies implementing eHealth solutions in Sri Lankan hospitals. As you, Sri Lanka is an emerging economy and very unique in the region because we are providing healthcare to all the people in the country charge. So our health system is mainly taxation and it is government funded. So for this health system, the electronic health is a new concept and used to improve the efficiency and effectiveness of the system. And for electronic record, electronic health definition, and the WHO or World Health Organization defines eHealth the use of information and communication technologies for health. It has got telehealth, telecare, and all that things. So, by implementing eHealth solutions in the hospitals, the issue is the policy concern. We can solutions, we can try to solutions, but the thing is the policy guidance, implementation part, difficult and chaotic, and also it becomes a problem in sustaining the systems we have implemented. C can be defined as a statement, directives, regulations, laws, and judicial interpretations that direct and manage the cycle of users. So, according to the statement, the policy is the shell for eHealth and implementation of So, this to go with system and the eHealth can have impact on the health system in Sri Lanka. I like to invite my co-host, Dr. Singh, to speak on the theme of Sri Lanka.
And before discussing the policy issues related to eHealth in our country, it's better to say a few words about our health system in Sri Lanka. It's a health system in Southeast Asia in a very good, comparatively very good health situation as a regional country. In our setup, we have two sectors, that is public sector and private sector, where public sector is a dominant, in which 81% of the services are provided to the public sector. And public sector provides preventive as well as curative sector, whereas private sector mostly curative care. And both sectors, public and private sector, is consisted of allopathic and ayurvedic system. In addition to these two sections, private sector is providing Siddha and Vinaya, those alternative systems of medicine to the public. And since the public sector is a dominant section in our health system, I would like to elaborate on this section. And we have allopathic section. We have two management systems. That is, we manage 60% of the health institutions centrally, and fully we manage 31%. So in Sri Lanka, we have 9 provinces. In each province, we have a unique health infrastructure, led by the provincial director of health service, and under him there are 3 or 2 regional directors covering the health system of their district. So that is our health setup, and under this government healthcare service, we have 3 levels of care. That is primary care, secondary care, and tertiary care. So the primary care, that is where the mainly preventive services exist, and we provide services to grassroots level through medical officer of health, who is in charge of certain areas. And in addition to that, village level primary medical care units are there, and divisional hospitals are also there to provide mainly the curative services. As a second level services, we have base hospitals, and they provide curative as well as preventive services. And tertiary care, that is a major component of our system. They are teaching hospitals and provincial general hospitals, district general hospitals are included in this type of care. So we have 1,026 healthcare institutions in Sri Lanka under these three categories. On the issue that our total population in the country is about 22 million. We get outdoor and indoor patients in our health system. So our patients, according to statistics, we have stated that the last statistical report says in outpatients we have treated, and it is more than 2.5% of our population, and in patients 5.8 million we have treated. So definitely indicates how our system is, the overcrowding of our system and why we need system and eHealth solution regarding for the improvement of our system. And in that, if we discuss why we need eHealth for Sri Lanka, I would like to highlight certain issues. Our literature surveys, we found that institutes in USA stated that facilitating IT solutions improves the healthcare services more. So in that worldwide, more than 50% of the countries, they have their own eHealth system. The prime countries, USA, UK, Denmark, Australia, and several other developed countries, they have their own health solutions and systems. So these and developing countries have their own objectives, eHealth policy objectives for health systems. Especially developed countries, what they want is to their patient-centered service through e-cards and several other methods. Whereas in developing countries, what we want is to improve remote area health through expansion of the health services. Likewise, different countries have different objectives. So, according to assessment of our need, we have to develop our e-health solution. In addition to that, what we expect is, according to the universal health coverage, we are supposed to develop our quality and safety in patient care, in addition to efficiency, equity, and furthermore, through these health solutions, we expect to reduce cost in the patient care system. So now towards developing eHealth solution in our country to achieve these objectives. If you have a history of electronic patient records in Sri Lanka, what we have done so far we are as a country, we are trying to improve our eHealth solution. So in this, what we have done, if I mention few things, we have several attempts, past attempts. And in 2003, with WHO funded program, we have tried to implement computer electric system countrywide, but it was not very successful. And after that, post-tsunami period in 2005 also, we again, with the help of the WHO funding, we tried to implement it again, but that time also it was not success. But we not worry, because studies say that only 30% of the this kind of programs get success immediately. So we have to do more and more. And the we identified was that lack of ownership for this software developed, and as a solution, currently we developed open source electronic patient record system in one of the regional directorates of the country with the collaboration of ICTA, that is Information and Communication Technology Agency in Sri Lanka. Also implemented in few hospitals, few remote hospitals in the country, and it's functioning in isolation, but we could not establish it in island-wide. So in this we did was identified we went through the literature survey available in our country, Sri Lankan setup. What are the things we have done so far to develop the eHealth solution and eHealth policy? To this, we did the literature survey. During that literature survey, we found that Rajan Koja et al. In 1990 had done an extensive survey, and there they identified 9 eHealth policy issues in relation to eHealth implementation of eHealth solutions. So in this et al, they have segmented these 99 eHealth policy issues into 9 themes. It is named as network care, interjurisdictional practice, diffusion of eHealth and addressing digital divide, integration into existing systems, response to new initiatives for all settings, development and research, investment, ethical legal issues. So what we did, our policy issues, we segmented according to these 9 themes, and here onwards we are going to discuss our eHealth policy issues in relation to these themes. So discussion will be started by Dr. Indika.
Thank you, Dr. Sindhu, and I am Dr. Indika Jagad again. So, when policy issues, the first policy issue we have encountered in implementing electronic health records in hospitals is network care. As earlier described, our system is very across all the country and extending up to the grassroots level. So therefore, these patients can from one institution to another. So there are no strict referrals or control mechanism. My convention, the government health sector is rating annually about roughly 3 times the population. So this is about 60 million patient records. So these records are kept manually. And maintaining and retrieving these records also when the patient, they have a freedom to go from the government sector or from the private sector. But when they go to the private sector, they have to pay. But there is a mechanism to share this information. So the policy of network care comes into the picture in this scenario. Then here policy issues that are related with the ability of provide organizations and jurisdictions to work in a coordinated manner to implement these solutions. In the network care, it covers areas such as interoperability, standardization, and intellectual property rights on materials produced as a result of this. So, the network care issue, the government has tried to address this issue through the development of interoperability framework, which is known as LIFE. So, it addresses problem, the policy issue, the e-government policy, and the Intellectual Property Act of Sri Lanka. To more on LIFE or Lanka Interoperability Network, initiative undertaken by the Ministry of Public Administration and Home Rate with collaboration of Information and Communication Technology Agency of Sri Lanka. And this interoperability framework has established the standards for data or the full data. This with the data element types required to store personal details of a person are identified and structured. So when we kind of a policy directive, it is very easy or develop inbuilt softwares which are able to or share the information. Yet we have to find what are data standards we are going to use if we are going to use SQL Server or something. The policy issue is interjurisdictional practice. This transfer information between different jurisdictions. That it has a special concern when it comes to shared data, transfer of information between government and private sector, comply with the government regulation and the development of public partnerships. It includes the issues related to management of health information in shared environment, follow privacy, confidentiality, intellectual property rights, guidelines for sharing knowledge, and research. And it deals with the proper positioning of health and accreditation of individuals and institutions. In Sri Lanka, some of these issues are covered by the Quarantine Disease Prevention Act. Even though we are using this act to address the issues in eHealth, this act is more than 100 years old. The Quarantine and Disease Prevention Act, the policy guidelines, how the patients they can be completed in proper when they are communicate data or information between different groups. Created and stored by the hospital health information systems must be stored and archived with the relevant provisions of the National Archives Act number of 1973. So that is the act which provides a guide or a certain direction to jurisdiction practice. In Sri Lanka, the draft health policy also tries to address these issues. It says measures shall be taken to ensure confidentiality of personal identifiable information and integrity of data, providing physical, local, and procedural security measures. The third division of eHealth and addressing the digital divide. Use of information and communication technology in healthcare, efficiency of service, and also the accessibility, and also will provide the financial protection to the patient as mentioned the universal health coverage. It will support the country in the sustainable development goals which the country by 2030. So, in India, we have very sound telecommunication infrastructure, and the entire internet and the communication is not a problem in most of the parts of the country. However, recently, the Sri Lankan government has taken an initiative to provide internet coverage to the end users of the Google. They are going to test the Google balloon or the Google loon in Sri Lanka by the March 2016. These information technologies to provide among the immediate population. So, the mobile technology is another way to address the Africa is a country where we have more handshakes than the population. OCT literacy somewhere around 40% in the country and steadily increasing. Also, in this e-government policy of the Sri Lanka, direction in the information communication technology in the organization, and it also states that every government institution should take initiative to action. All the new governments has the importance of this and separate ministry for the communication and digital structure. This will basically improve the accessibility and communication technology in countries, and also it will address the problem of digital divide. Fourth is the integration into the existing system. eHealth all the problem of integrating into the existing system, which is to plan very carefully. What are the things we are applying the Indian communication technologies, because sometimes the new technology is more expensive and less effective. Or what essentially device developed, it has to be integrated into the existing system. Otherwise, it will generate a lot of policy and legal issues and also administrative issues. Or if we are going to into electronic DHT, we have to see what is the hardware. All to in the, or the real life environment in the clinical setting. If we can have electronic DHT, if they are the mobility of the system, it will definitely increase. Operating into the existing system, there are a lot of many coming. Integrating into the existing system, there will be policies to govern this new system. This should guide the strategic direction on legal and ethical issues. The fifth one is the response to new initiatives. The people do not want to change their comfort, you operate in their comfort zone. But they introduce the eHealth solution, which will change the system, and most of the time it will challenge comfort zones of the people. So, when implement solutions, the efficiency of the institutions to implement eHealth solutions is a major issue. There is a physical capacity, there should be a human resource capacity. The software should address the needs, and so there should be champions. So we want top management or the support of the top management is already very important in the system. We do have some response from top management, it will definitely be. And the top management or the top manager or the strategic leader, they will say who will take the policy. So we need or the top level users who are positive or positive to these communities. And when implementing these pillars, to use the institutions which are more responsive or more favorable. Also, champion change or the leaders the first will be should be future or future oriented. It should address evolving technological changes also. The technology today or the latest technology today may be of excellence. The policy should provide the place to rescue technological advancement. Also, we have to have policies which will put the capacity of institutions and individuals in the response to this issue. The policy should be human resource development, technology development, technology acquisition, and technology. For these things, we need clear guidelines. Most of these things are addressed by other policies. Some strategic guidelines are given by the government policy. The government policy states that each institution should develop their own policy. But health sector, we do not have a government or state information policy. This is in the class stage, and it tries to address these problems that bring more complete solutions. The policy goal is another policy issue when implementing legal solutions. These are the policy ways to implement legal solutions. It is as in other ways, because of the guidelines or the fears they are laid down for manual or the manual. When implementing solution, most of the time we have to read or the re-engineer the process and also restructure the organization. When in solution, the RTL-based organization structure becomes the more flexible, fluid, or native structure. The higher system has to be abolished. The low level would be given authority to carry out the transaction. These are the issues because this always depend on the hierarchy and the solution or the eHealth or ICT system and because utilization of one feature. Or this the implementation of eHealth solution demands more flatter organization structure. It has to be addressed at the policy level. So, of course, has to be in or in given more with some of the which has not assigned to them become part of the normal work of the state. Those schools, some person and which we try to some trade unions these laws. So the policies should think or the policy should think these things and develop procedures accordingly. The next part, the evaluation and research, it will be explained by my colleague, Dr.
Thank you. This is we have come to the latter part of our policy team and the seventh evaluation and research. And this regard, what I would like to say is, in any other areas, evaluation and research is also very important in challenging. And up to now, the Informatics Society of Sri Lanka 2010 has published their own journal, which writes about what the researchers which have been in this area, and say that so far only 85 research in this respect, and among those 85 research, 50% of them explain the initiation and introduction of the eHealth solution within the country, and 14% describe the current process of the eHealth solution implemented. And there was only one economic evaluation on this regard, and one control trial is being done. So that is very minimum we have done on this research area. It needs more improvements. Here we need this evaluation on cost effectiveness and impact of the health cost. Through this eHealth solution, we are expected to reduce our healthcare costs, and we need information regarding cost reduction. So, as in this area, I would like to mention that we have implemented EIMMR, that is electronic-based mobility and mortality register, which was annually for several decades in the country. As a successful event of the second health sector development project, was identified as the first linked indicator. So the result-based solution was able to successfully complete this project, and now as a result, the eIMMR, electronic-based window mobility mortality ratio data is available. So we generate prompt annual data, quarterly data, and whenever we want disease data, it is available in our system as development of this electronic IMMR. So that's one of the success areas under this scheme, which I would like to mention. So it's the eighth area in our policy issues. Any eHealth solution, we take it as an investment. But investment, eHealth as an investment, we don't see the benefit as soon as we implement it. It's a long-term investment. So we have to wait and see how it works. So as an investment, we need to develop a business model in this eHealth solution. I would like to mention there are two successful investments we have done so far in this area. That is eIMMR, which I described previously in the previous topic. Electronic-based indemnity mortality register, which provide us the prompt data regarding disease, mobility, and mortality. The second is the hospital health information system, which is also another successful implementation of the eHealth solution, where we get as and when we want the necessary details of the hospital information to a developed and thematic area is ethical and legal issues. Even if it is the last one, it is very important. important because in this e-health solutions, ethical and legal issues are very important. Concerns of this area is the patient consent, professional portability, management of information, validity, medical issues, secure information, and ownership of data. And I would like to mention that the legal framework in the country does not address or weakly address in these areas regarding e-health solutions. However, two acts I would like to mention at least address a few areas of this topic. The Electronic Transaction Act in 2006 and Computer Crime Act. In addition to these two, the draft e-health policy which we mentioned earlier covers the three areas, that is privacy, confidentiality, and information security. It comes, it's policy issue areas. And finally, I would like to mention that Global Observatory for Health survey done in Sri Lanka, they concluded that there is a favorable foundation and organizational support for the introduction of e-health activities in Sri Lanka. And they also mentioned that lack of central coordination effectiveness is a problem they have identified in implementing these e-health solutions. So we would to discussion, and Indika will say where we are now.
Now, finally, if we see where are we? eHealth is in Lanka. So, major issue administrators face when implementing eHealth solutions is the policy issue. The policy, as we don't have an eHealth policy or health information policy in Sri Lanka, we rely on policy and adapt over to be guided by them. But the government or as a country, we have adequate draft policies relation to electronic information management, especially with regard to the acts analysis developed to facilitate electronic transactions or electronic transactions. So most policies or the acts can be used when we implement electronic health records in Lankan government. The policy of the government is e-government policy. It provides an umbrella framework or umbrella guidance or umbrella coverage for the electronic solutions. Or in the country we are debating whether we need an e-health policy or a health information policy. So what developed sector, it has to be aligned with the government policies and also the technology and other transactions living in our country. Especially these things are very, very relevant when thinking of promoting medicine and improving of some services from other countries such as digital radiology. So to establish these things and to develop business models for these things, we need proper policies and rules. At the health, issues of drafting these policies, and it will be a reality very soon. And with this, we would like to conclude our presentation and hear from Sri Lanka. Dr. Indika Jota and my co-presenter, Dr. Samarapur, want to Thank you all, and also giving this opportunity and the Health Informative Society of Sri Lanka this event, and Dr. Mohd Amarapur for supporting throughout this event. Thanks.
Thank you very much, Dr. Shagada and Samarkand. It was a very informative, elaborated presentation, and you surely inspired the audience with your content and in pursuing solutions to address the policy issues highlighted here. Audience must be having a lot of questions to clarify both of them. Please use the Q&A button on your panel to type in your questions. We try our best to accommodate all the questions. We also provide facility to ask questions using voice if you have a good internet connectivity and minimum background disturbance. Please mention Q&A box if you are available for connecting via voice. We'll all do the presentation done by Dr. Jagada and Dr. Samarkand after the eHealth hour today. Which from our audience, the first question was, what is the role in private sector and other fields of healthcare, such as Ayurveda medicine, in eHealth policy making? Are they helpful so far? I'll repeat the question. What is the role of the private sector and other modes of healthcare in eHealth policy making? Being helpful so far?
The private sector has been helpful because we need some information from the private sector, especially we develop the national. If the private sector is not giving the information, we are not maintained properly. Also, the private sector is regulated by the government through the Private Health Services Regulatory Council. So, when the Private Services Regulatory Council, which is a directive, they are all legally bound to provide information. But so, this private has been very, very helpful in information. But the sector or the indigenous medicine sector functioning separately, and so they do need some sort of electronic data integration method to share, to get the information and share the tools.
Dr. Jagada, our next is, any research done on the people's perspective and their views on integrating eHealth into current health system? I repeat the question. Are there any research done on the people's perspective and their views on integrating eHealth to current health system?
To the best of my knowledge, I am not I have published research. Aware of some of the surveys carried out in the hospitals where electronic health records were health records implemented. And the surveys show people are very happy about the electronic system because it has helped to reduce the waiting time in the outpatient department.
Question is from Mr. Kapila Vijayvira. He asks, what is the perception of health staff regarding integrating eHealth to existing system? What is the health staff regarding integrating eHealth to the existing system?
They are quite okay to they are quite okay to regarding integrating this eHealth system into our health setup, but certain difficulties in maintaining equipment and infrastructure issues are there provide adequate equipment and provide the proper training and all. But in future, I think we will be able to, as our health sector fastly growing, and we will be able to address those issues as well, to provide training and provide necessary equipment and make them, to contribute to this integrated term.
Thanks, Dr. Samarkwan. Hope it provides the answer for the question. The next question goes as, has Lanka interoperability framework currently been implemented? If so, to what extent?
To the best of my knowledge, the Lanka interoperability framework is used to developing the software. So, HIMS software, it uses the standards defined by the Lanka interoperability network.
The next question is by Mr. Nimal Jayatilaka. Has there been any concern over anonymizing user identifiable data developing national eHealth policy in Sri Lanka? If so, what steps have been taken? Is there any concern over anonymizing user identifiable data when developing national eHealth policy in Sri Lanka? If so, what are the steps that have been taken?
And the anonymity is a very important in provision of healthcare. So institution and also every healthcare provider a maximum to read the anonymity of the patient they deal with. Therefore, to preserve anonymity, the Ministry of Health has introduced the health identification number, where the patients will be identified through only the number. So this is unique to the health system and it is not shared with any other patient. So that is the reason they don't use the national identity card number or the NIC number as the patient identifier. Because if we use national identity card number, there is a possibility that by this number, the patient can be traced. Anonymity will be a problem.
Very much, Dr. Jagada. The next question is also from Mr. Nimal Jayatilaka. It goes, has been on discussion as to a separate specialty on health informatics is needed for the medical domain of Sri Lanka. What are thoughts about this? I repeat the question. It has been on discussion as to a separate specialty on health informatics is needed for the medical domain of Sri Lanka. What are you?
Yes, the health system and the PGIM is unique in this that we are training doctors or medically qualified doctors in health. They will have a knowledge on both medical aspects and also on IT aspects. It is similar to legal administration, where the medical qualified doctors are trained to manage health issues. So potential, but although it has a link to the subjects such as epidemiology, which is information science. Also, the health information or the doctors, they can contribute in lot such as mathematical modeling and helping in forecasting and derivation techniques and all these. So there's a huge potential and it is very important to train doctors on health informatics. But all we have to be very concerned about the return of investment and what is the training need and to address these things. And so we have to concern about the training after obtaining their master.
Thank you, Dr. Jagada. The next question is also from Mr. Kapila Pereira. It goes as, what are the suggestions for maintaining health database of whole population of Sri Lanka? Has there notes of a centralized database? If so, has it been considered how to maintain the smooth functioning of a healthcare institute in the event of a failing network connecting healthcare institutes of the country? I will repeat the question. What are suggestions for maintaining health database of all population of Sri Lanka? Have there been any thoughts of a centralized database? If so, has it been considered how to maintain the smooth functioning of healthcare institutes in the event of failure of network connecting healthcare institutes of the country?
At the moment where these electronic health records, hospitals where these electronic health records are implemented, maintain their servers and their database. So these two some concerns. One is the expense. You have to incur maintaining a separate database or a data center at each and every institution. It has been suggested to have a central database with the which give access to all the providers or the institutions. But maintaining the central database, again there are problems, like we have to maintain a huge data center and also connectivity is a problem. So we have to think in balance what is more suited. Database, the cost of maintaining these things will be less, but there will be problems with the connectivity and as you said, there's a breakdown. So what has been suggested is to some database at local level, which will set the functioning in the event of breakdown, and later it can be linked to database when the technical problem is sorted out. So the thinking at the moment we are working on this and try to find the best solution.
Yeah, we have two more questions. The first one is, it has been widely felt that human resource for software development and maintaining is adequate in Ministry of Health. What are suggestions you would like to suggest to overcome this barrier? It has been widely felt that human resource for software development and maintenance is not adequate at Ministry of Health. What are solutions you would suggest to overcome this barrier?
For me, actually, it has been felt that the human resource is not enough to maintain these chronic patients at the Ministry of Health. We need different categories of human resource, from in the hardware to the development of software, networking, etc. To address this problem in one aspect, the Ministry of Health, with the assistance of the Postgraduate Institute of Medicine, they are training doctors in health informatics. But they also trained in some, but not all aspects in the software industry, which is not possible. So they have need to identify what are the staff or the skill levels we need, and also to develop people accordingly. Sometimes we lose our requirements and get services outside.
Thank you very much, Dr. Jagada. We have one final question, and this is from Mr. Samira Vijay Dialogue. It goes, HIPAA or similar policy available in Sri Lanka? Is HIPAA similar policy available in Sri Lanka?
Yeah, this is relating to the privacy. Actually, the privacy is not in HIPAA in Sri Lanka. But the draft eHealth policy or the health information policy is addressing that. But some are address the Computer Crimes Act, which is that it is to use the data which is not intended for the use. So if somebody is stealing data or somebody is manipulating some data, so it's a punishable offense in the or in the draft health information policy is going to address.
Since our allocated time has come to an end, we will be concluding the 6th Lankan eHealth Hour for today. If you have further questions to ask from the panelists, please feel free to forward to us. We will try to distribute the resource material and the answers to the questions to you via email. We would be grateful if you could also submit the feedback form we send it to you via email after this webinar. Please join with us for our next Sri Lankan eHealth Hour on 8th October 2015 at 12 noon. If you are medics and willing to share your experience with the eHealth community of Sri Lanka, we can arrange you a session at Sri Lankan eHealth Hour. Feel free to contact us. Once again, we are grateful for the panelists today, Dr. Indika Jagwade and Dr. Shamit Samarkon, for giving us the valuable information. I must also thank Dr. Acha Jayatilaka and Dr. Jayatri Vijayarathne for assisting in conducting this eHealth webinar today. And I must thank finally to all attendees from around the globe as well as eHealth for providing us with the WebEx platform. See you on 8th October. Bye-bye from Colombo.